After weeks of watching the coronavirus, or COVID-19 as it's known, wreak havoc in China, Korea, Japan, Iran, and Italy, the virus arrived in Vermont last week, in Bennington County. The state, along with the rest of the nation, is bracing for the arrival of more cases, and hospitals are ramping up to prepare. The Southwest Vermont Medical Center has opened a drive-up test site and say they have a sufficient supply of test kits on hand. So we reached out to Dr. Thomas Sterling, Manchester's Deputy Health Officer, who is one of the principals at Manchester Urgent Care.
Yeah, so COVID-19 is a virus like most other viruses, and similar to influenza. At the moment, it's spread by respiratory contact and droplets. What we're seeing now is that the likely spread would be a one person to one person. So if one person has a disease, they're likely to spread it to another person, unlike things like chickenpox, where, for example, it's 1 to 5 people. So we're seeing a 1-to-1 ratio of that, and it's really spread mostly by respiratory contact, i.e. you cough or you have the virus on your hands, you put it onto something, someone else picks that up. So some of the symptoms that people might notice would be a shortness of breath. They may notice that they are experiencing what we call malaise, which is basically if you're coming in to say, I feel sick, I feel worn down. And also they may have a fever. So we will look at fever, we look at respiratory symptoms, shortness of breath, and then we look at malaise. Exactly. So if you feel that you may have COVID-19, you should call your primary care doctor. When you call your doctor, they're prepared in this area to answer your questions, to screen you over the phone. And if you are deemed to be indeed significantly likely to have the disease, they'll recommend of how you're to be treated or even tested first and then treated. Well, at the moment, I think that a self-quarantine is a very conservative approach. In other words, if you think you may have this disease, then yes, quarantining yourself for 14 days would establish you as being safe and not giving this virus to another person. So who should quarantine themselves? Well, what I suggest is that if you think you may have the disease, you call your primary care doctor. They will then recommend if you should be treated, tested, or if you should simply be in quarantine. If you were to come into the Manchester Medical Center here, we would assess you. And if you did have shortness of breath, and you had a fever, and you had malaise, and you felt ill, and we deemed that it was appropriate to look for a virus, we would do an influenza test here for influenza B and A. We would also look for RSV, given the fact that we're looking for coronavirus as well. And if you were negative with both of those, we would then be looking at the coronavirus if we thought it was appropriate.
For the GNAT-TV News Project, I'm Andrew McKeever.